amniotic membrane transplantation, which is one of the new surgical transplantation techniques to restore vision in blind people. That I will show you some of the photographs that I've taken in my laboratory and at the Wang Vision Institute. Here you see amniotic membrane put in a bottle, and we have been developing and in fact have successfully made world's first amniotic contact lens based on my US patent. And this contact lens is undergoing current study, and if successful, we hope that it will be available in the medical clinics throughout the world and really make a difference in preventing blindness or reducing blindness after trauma. And we already successfully demonstrated, and I have published a paper that demonstrates in the laboratory it is successful. Next slide, please. Here I will show you some patient. This is a patient who terminally blind. This is a picture after amniotic membrane transplantation. Next slide, please. And this is the photograph of the same patient after amniotic membrane and a stem cell transplantation. I've been one of the few surgeons in this country specialized in stem cell transplantation. And this is a picture of the patient. Next slide, please. This is a second patient who has been blind for 20 years, and this is amniotic membrane transplantation. Next slide. And this is after amniotic membrane and stem cell transplantation. You can see actually resembling an eyeball. Next slide. And this is 2 years after the surgery. And patient can see 20/70. Next slide, please. This is a patient after thermal injury, completely blind, hand motion vision. Current technology offers no solution. Next slide. And here, after stem cell transplantation, interesting thing about this patient is he is a Caucasian individual and has a stem cell transplantation from an Afro-American gentleman. And it shows that this tissue transplantation can really work between individuals. Next slide, please. And this patient has been blind for many years, and you could even see the eyeball. Next slide, please. And this is after amniotic membrane transplantation. And next slide. And here is the appearance of the eye today. Next slide. So these type of novel eye reconstructive surgery that we have been involved in and will continue to be investigated and researched at the Wang Vision Institute help us always stay at the cutting edge of technology, provides not only the best laser technology to our patients for laser vision correction, but also the newest, most innovative technology to restore vision in blind, terminally irreversibly blind patients from trauma. And the technique is very exciting because we utilize tapping the fountain of youth, I often call that. Next slide, please. Let's return to vision correction. For laser vision correction, there are these lists of options: LASIK, LTK, PRK, AK, and lensectomy. As I said, three-dimensional technology is bringing on the next dimension, improve the technology, and we have been very fortunate to be the first clinic to introduce this technology. Next slide. In LASIK works by creating a flap. The laser reshapes the cornea and put the flap back. And PRK will shape directly the surface. Next slide, please. LTK is a new technology which is undergoing continued development and improvement to correct hyperopia. Next slide, please. Now, I often get this question. Patient will say, Dr. Wang, can this technology correct the need for reading glasses? The answer is a partial solution. Some of you, if you are a good monovision candidate, meaning you can use one eye distance, one eye near, we can enable you to get rid of glasses for both distance. If you're not monovision candidate, we can at least use today's technology, improve your distance vision in both eyes. So we can correct hyperopia now in almost all the cases, majority of cases, and we can correct presbyopia, the short arm syndrome. As we get older, our arms get shorter, in some of the cases, about 30 or 40%. Next slide, please. This is a very important slide. I want to stress that LASIK surgery is not a perfect surgery. No medical treatment is perfect. We want to make sure we always understand the potential risk and complications. Generally speaking, there are two kinds of complications: surgical complication and wound healing complication. Surgical complication, either machine malfunctioning, the laser is not well calibrated or tuned, maybe surgical instrumentation or surgeon's error. This is to be avoided if at all possible. The second is, despite the correct surgery performed, one may have different differences in wound healing. Next slide, please. Such as dry eyes, night vision problems, and also healing complication and sometimes require enhancement. One may ask, if surgery is reasonably good, how come there are differences between patients? The answer to that question is very simple. If you and I take the same pill, penicillin, same medication, same chemical composition and weight, it may work beautifully for you to cure infection. I could be allergic to it. It's not the fault of the medication. The treatment is identical. It's because you and I are made differently. We always need to bear in mind that there's small risk involved in LASIK surgery. The surgery is not perfect. If you are a patient who requires perfection, you always want everything has to be perfect, and 2025 is unbearable. And I suggest don't do anything. Remember, it's elective surgery. One does not to have it done. Through our very careful evaluation, in our evaluation, we check 50 different measurements, and we only qualify you when you fit every single criteria. We can significantly reduce most of these complications and can successfully manage most of them. At the Wang Vision Institute, we're one of the most busiest complication referral clinics in the United States today. We see about 2 or 3 complications referring a day. And many of these complications were due to the fact that patients should not have surgery before. So we fortunately can fix most of the problems, but some of them is very difficult to fix. So I always stress to the patient, make sure you have done the right homework and make sure it's right for you. Next slide, please. Tiger Woods had surgery, and he said the golf hole looks bigger to him. That's the right quote. Next slide, please. Laser vision correction is changing the way we live, and glasses may become a thing of the past. Next slide, please. Next slide. Remember that the most important thing is always make sure that you understand the bottom line of laser vision correction. That is safety, safety, safety. At the Wang Vision Institute, we're very fortunate to introduce this 3-dimensional next-generation technology, and which expected to significantly improve the accuracy of our measurements and treatment. And we have been asked to start the first ever clinical studies on this instrument. And here's the take-home message. 3 cornerstones for LASIK. Number 1, you have to be the right patient, patient selection. And don't do anything if it's not right for you. Number 2, you have to use the right technology. How can you find the best technology objectively? Which laser to use, which laser center to go? My suggestion is trust where other doctors go. Number 3, you have to find the best surgeon who is not only a cornea specialist and have done many procedures, but also has low complication rate, safety. The best way I recommend is go with where other doctors themselves go, because in a way they have done homework for you. Laser vision correction is changing the way we live. I do believe we're moving into a society in which glasses will become a thing of past. But always remember, only when it's right for you, then you can consider. Otherwise, leave your eyes alone. Thank you for having spent time watching this video regarding laser vision correction. If you have any further questions, please do not hesitate to contact us at the Wang Vision Institute. Our telephone number is 615-321-8881. Our website is www.drmingwang.com, which spells drmingwang.com. Thank you.